Hi, and welcome to Prescription for Change. I am your host, Dr. Warden-Jarrett, and I'm a proud board-certified family physician. Today's topic is a woman's guide to birth control. Now, birth control can be a very complicated issue, very complicated, but I'm going to try to break it down and keep it as simple as possible. But when you choose to go on birth control, the first thing is to get information and be aware and schedule an appointment with your provider so that you can go over all the available options that are out there. Now, as I see it, there are three big options. There are way more than that, but you have abstinence, which is just avoid sexual intercourse, because if you're not having sex, guess what? You're not going to get pregnant. The second course would be some type of barrier. And an example of a barrier protection would be like a condom, a diaphragm. These are things that can keep women from getting pregnant through a barrier method, meaning that the semen is blocked from fertilizing with the egg and therefore a baby cannot be formed. And the third option is playing around with your hormones or oral contraception or some type of other contraception that involves manipulation of hormones. Now, when we go the hormonal route, which is probably a common route, you have to also keep in mind that the hormones don't protect you from STDs, so it's still very important to use a condom during sexual intercourse. Now, the hormones, as I tell my patients, they basically hijack your brain and ovary pathway. Normally, the brain sends a signal to the ovary then releases an egg, and at the same time in the uterus, it's making the uterus nice and plump so that an egg can fertilize there, and it's also doing things to the mucus so that it makes it more available for semen and sperm to enter in and fertilize with that egg. But that's what normally happens, and so the hormones hijack that pathway, and instead of it being like your brain telling the ovary what to do, there's now a player that takes over that relationship with a synthetic hormone called progestin, and usually people usually take estrogen as well. And we can go over that during your office visit so you can understand the full details. But in general, the choices are abstinence, a barrier, and a hormone. And with the hormones, there's usually a pill that you can take. You can do it through an injection. You can do it through something that's implanted, a patch, and sometimes even something that's insertable in the vagina like the NuvaRing. And then some people even use intrauterine devices to help. So there are a lot of different options out there for women, but the key to making that decision is knowing if it's the right one for you. All women are not created equally, and one size does not fit all. So it's important to talk to your healthcare provider, the one you know and trust, and be very open and honest with them so that we can come up with a regimen that's right for you. It has to be right for you. And I think once we start having those open and honest dialogues, you can be on that pathway to wellness and living a very good holistic life so that you're not having babies when you don't want to have them, and when you're ready to have them, you're mentally and physically ready to do that transition. I hope this has answered some of your questions, and if you have more, please schedule an appointment to see me or your healthcare provider. And this should at least get you started with doing some research and finding out things. Because, like any medication or any treatment, I can say with the hormones, there's some side effects, and maybe the side effects may or may not be right for you, but those are things that you have to discuss with your provider in person. For now, this is Dr. Jarrett signing off. This has been your Prescription for Change.